Hey guys, it's Jennifer Ringgold, recently Jennifer Townsley. Still working on getting all my name changed everywhere, so you'll have to forgive me. Alright, so my IPP project was dealing with timely CVC removal, so central venous catheters. I work at a dialysis unit, so I deal with a lot of central venous catheters on a daily basis. So yeah, the biggest thing with those is just infection risk and so many complications from having them long term. I mean, they are fantastic if you need access, venous access now for a catheter or for dialysis treatment, because you can get them in real quick, you can get the patient dialyzed, they can get to feeling better immediately, like same day turnaround. The problem is a lot of patients don't want to get them out because I don't know if they're just scared to be cannulated with those big 14 gauge needles. They are pretty intimidating once you get your fistula graft and you have two giant needles in your arms for 3-4 hours a day, 3 days a week. So I think that's part of the problem. Another part is they just get comfortable having that catheter and just don't want to get it out, don't want to treat anybody else, and they don't understand the risks that come with those. A lot of times we'll start seeing them degrade in treatment, can't get the blood flow rate going as high as it needs to be, can't keep them on treatment as long as they need to be, start having to reverse the feeds, just little telltale things like that, or signs the catheter is starting to go out. And I've had patients get them replaced literally dozens of times because they don't want to get it removed. And now they're out of options for other catheters, and without another access in place, ready to go, because fistulas and grafts take a while to mature before you can cannulate and treat with them. Yeah, you're looking at life and death situations just from not having access. The other big thing with them is there's so much higher infection risk just because it is an open catheter directly into your system. So we've seen tons and tons and tons of infections with them. And I mean, it's been known to kill patients just because we can't keep battling those infections. It's so hard on your system. And then with the catheter going out, you're not getting the treatment you need. You're not cleansing those toxins out the system. I sound like I've been doing this forever. I've only literally been at the dialysis clinic for a year now. And we have a high turnover, so it's sad to say I am one of the longest nurses working there at the moment. So hey, if you're looking for a job, hit me up. But yeah, so a lot of the newer nurses don't understand once you start seeing that degradation in treatment and catheter going out, like how big a deal that actually is and how much we need to push these patients to get those catheters out. So thanks to my little brochure and IPP project, I was able to educate a couple of new nurses and even a couple of the older nurses. I think you get compliant and forget why we do what we do. And so that really helped reinforce that teaching they already had. And I was able to present it to a couple of my long-term catheter patients. I didn't get them all, but I got one to start looking for a surgeon to get her catheter removed and get alternate access placed. So yay, I got one. That's a start. I'm hoping I can keep working on the other ones. They're just, stubborn patients. You do what you can. I'm just going to keep educating and keep hoping for the best. So that's how my project's affected the community. I've got one patient out of the 5 I presented to. 5 or 6? I can't remember, I'm sorry. So that's pretty good. I'm hoping I can just keep reinforcing that teaching and driving it home that catheters need to be short term. We need to keep them as immediate emergency access. They're not a long-term solution for dialysis. So there's my project. I hope everyone's went as well, if not better. And it's been great. Thanks, guys.